Hi, everybody out there in Facebook land. I'm Jamie Callie here with Dr. Kimberly Gygi from Starling Physicians, and today we're talking about the flu. Thank you for joining us.
Oh, thanks for having me.
So flu season, it's in full swing. What are you seeing?
We're seeing a lot of influenza A, which can be kind of a complicated presentation. A lot of people will just think they have the common cold, you know, the runny nose, stuffy nose, cough, but then fever. Some people are getting high fevers in the 104 range, just feeling miserable, body aches. And that's usually when they come to see me.
Now, you say they think they have the common cold. How do you know when you have the cold or when you have the flu and you should go to the doctor?
That can be really hard. So especially with the flu, as far as getting any sort of treatment to help reduce the length of your illness, we have to start that treatment within 48 hours of your symptoms. So I kind of recommend people, especially at this time of year, with January and February being the busiest time for flu season, to come in.
Better safe than sorry?
Better safe than sorry. You know, we can do a quick test, takes about 10 minutes, and let you know right then if you have the flu or not.
So you come to see you, you test positive for the flu. What happens then?
We talk about, like I said, when your symptoms started. If it's more than 48 hours, something like Tamiflu isn't really going to reduce your illness much, and the possible risks of the medication can really outweigh the benefits at that point. So it's not recommended for, you know, if you're relatively healthy, not going into the hospital. If you've been sick for more than 48 hours, the medication's not recommended.
So let's talk about the flu shot.
Okay.
You recommend people get it?
Yes, because ideally we'd like to prevent you from ever having the flu.
Now it's January. I, for one, I haven't gotten my flu shot yet. I normally do. Is it too late for me?
It's not too late. Peak season is usually February. So once you get the vaccine, it takes about 1 to 2 weeks to really become effective. So right now would be the perfect time to get it done.
Ideally, when should someone get the flu shot?
Ideally, you want to do October, not any earlier than that, so you last and you are protected through the whole season.
Does it expire?
It does expire. So every year they come up with a different formulation for flu vaccines. They do research and pick what strains they think will be most prevalent. So it expires in that sense, and the immunity only lasts a few months.
And you said 2 weeks it takes from the time?
About 2 weeks.
Now, the flu can be deadly. We're seeing, we have had a few deaths in Connecticut. Who's most at risk?
I'd say the extremes of age, so the very young and the very old. And obviously, if you have other medical illnesses, you are more at risk for complications.
And where do you go? How do you know if you should go to the hospital, if you should see a doctor?
Your primary care doctor is always a great place to start. Sometimes even just a phone call, if you can call in and say what you're experiencing, they can say, yeah, come in, we'll take care of you, or, oh, geez, you just need to go to the ER. But like we were talking about, vaccinating ahead of time, 6 months old and older can receive the flu vaccine. And then if you're over 65, there's a special high dose flu that has flu vaccine that has more of that antigen or the active ingredient that stimulates your immune system. So that reduces your risk of flu 25% more than just the standard flu shot.
Now, we have some questions from people on Facebook. Melissa wants to know, her 6-year-old just tested positive for the flu, but she had an allergic reaction to Tamiflu. Is there anything else she can give her?
There are a few other medications in the same line, yes, because allergies are common.
And people talk about getting a reaction sometimes to the flu shot. Is it a myth? Do people really have adverse reactions? Can they get the flu from the flu shot?
You can definitely get adverse reactions to the flu shot. They're usually pretty minor, you know, maybe some soreness in your arm or some redness. Most of the flu vaccines are inactivated, so the virus is dead or damaged, so there's no chance of getting the flu. But, you know, when you are exposed to the virus, it's usually got an incubation time. It stays in your system for a week, 10 days before you start having symptoms. So who knows what you were doing last Tuesday.
Right.
You got the shot, you know, this Thursday. You can't pick that up anywhere.
Right. Denise wants to know if Tamiflu really does help. She's heard that it might mess with her stomach.
very common side effect. I'd say pretty much any medication could cause some stomach upset. Tamiflu can cause some diarrhea, but the flu can also cause diarrhea, so sometimes it's hard to pick out what's side effects to the medication, what's the illness.
Is there anyone who shouldn't take it?
It's pretty well received, but yeah, if you have bad digestive symptoms, if you have neurologic problems that aren't quite diagnosed yet, it might be a good idea to stay away. But it's pretty well tolerated.
And if you are outside of that 48-hour window, then is there anything you can do?
If you're outside the 48-hour window and you're not sick enough to be hospitalized, it's pretty much just go home, take care of yourself, plenty of fluids, your antipyretics to bring down the fever, the Tylenol, Motrin, Aleve, whatever your medication of choice is.
Donna wants to know, can you be a carrier of the flu but not actually get it?
I would say that it's possible. Is it probable? Not really.
Not really. Okay. Now, if someone in your family tests positive for the flu, can other family members take Tamiflu as a precaution? Is
Yes,
that common?
you definitely can. And that's one of the nice things about family medicine. We like to ideally have like the whole family seeing one doctor, and you get to see different generations. But then if like, your 6-year-old has the flu and you've been, cuddling them and comforting them right up in your face for the last day or two.
You're probably gonna get it.
And all night, yeah, you're so at risk. So, it's just, we call it prophylactic treatment. If you've had close exposure to someone with the flu, we just give you the medication, even if you're not having symptoms.
Now, you just mentioned you're a family medicine practitioner. How is that different from an internal medicine doctor?
There's a lot of similarities, a lot. I'd say the big difference is that we, as family medicine providers, we see all ages. So once you're out of the hospital and 2 days old to however old you want to get, like we have training and we know how to keep you as well as possible. If you got high blood pressure, diabetes, or if you don't know what's wrong with you, coming in to see a primary care doc is like a really good place to just start. And we can help kind of direct you through the medical system.
But one of the advantages is the whole family can conceive.
Exactly.
So in a case like the flu or other illnesses that are contagious.
Yeah, so it's really nice. Oh yeah, we just pull up your chart and send the med over to your pharmacy and you pick up both kind of thing.
Now, some people confuse the stomach virus with the flu, but they're two totally different things. Can you throw up from the actual flu, though?
You can, yeah. The flu has so many symptoms, like we said. Runny nose, stuffy nose. The fever and the muscle aches are the two big ones that people really think of when they think of the flu, but that with cough is also a symptom of pneumonia, so there's a lot of overlap, a lot. But yes, stomach symptoms, throwing up, diarrhea, just feeling really sick to your stomach.
When do you go to the hospital? When is it like, okay, this is not getting any better, I'm feeling worse? Is there a sign that, okay, enough's enough?
Big ones like trouble breathing, severe chest pain. If you can't keep anything down, liquids, you're just at greater risk for becoming dehydrated. So going to the emergency department and being evaluated is a good idea at that point. If you're feeling very lightheaded or like you might pass out, other reasons to
Now,
seek emergent care.
we touched on this a little bit, but Paxton does want to know if the flu shot wears off after a couple of months.
It does.
It does.
It does, yep. So flu season is typically October to April. So the flu shot covers for those 6 months about. Sometimes the flu, I remember last year I was seeing people in May coming in with the flu. So sometimes it does last a little bit longer.
Is this season worse compared to other years that you've seen?
This season, from what I've seen personally in my practice, people were really, really good about getting the vaccine this year. I think last year was quite a scare. So from what I've seen, it's not quite as bad as far as the severity of the illness. So if you get the flu shot, even if you do end up becoming sick with the flu, your symptoms are more likely to be less severe than they would have been had you not gotten the vaccine.
Right. We are getting a lot of questions from our Facebook fans. Tiffany wants to know, is it common to mistake bronchitis for the flu? She was told the other day she has bronchitis, but her body's so weak she can barely move.
Yes, and that's where a stethoscope is your best friend. Usually just, and you can have the flu and then have that trigger a bronchitis too. So having a good conversation with your medical provider and then a good physical exam, plus or minus that flu swab, can just help narrow things down.
Jennifer says she has a 3-month-old baby. It's her first child. Babies can't get the flu shot until they're 6 months old.
Right.
If her or her husband get the flu, what should they do? Should they not go near the baby?
Well, you got to go near your 3-month-old baby. So good hand hygiene, covering your mouth when you're coughing. If you're breastfeeding, some of the antibodies can get transferred to baby, so baby might have a little bit of protection there.
And Melissa says she had the flu and bronchitis last Monday. How long does it take to get your energy back?
Oh, if I could give the answer to that question, I'd make a lot of people much happier. It's so subjective. Everyone recovers differently. Everyone experiences the flu a little bit differently, but you're still considered very contagious until you've been without a fever for 24 hours. A lot of people are kind of unsure of what a fever is. A fever is 100.4 degrees Fahrenheit or higher. So if you've been without a fever for 24 hours, and that's without having to take any of your Tylenol, aspirin, Motrin, that kind of thing, then you're much less contagious. So that's kind of when things start to go better. So you should start feeling a little better once that fever breaks. But those muscle aches and pains and the tiredness can really stick around.
How long does someone typically have the fever and have those major symptoms when they have the flu?
Anywhere from 2 days to a week, 10 days. Yeah.
So you're really down and out.
It can really knock you on your butt. Yeah.
Is there anything, if you could say anything to the people watching right now about the flu and the flu shot, what would your message be?
My message is primarily, first, you want to try and prevent the flu. But if you're having symptoms, your hand hygiene and covering your cough, and get in to see your doctor.
For those of you joining us, we're speaking with Dr. Kimberly Gygi. She's with Starling Physicians. And where can we find you?
My practice is in Newington, 375 Willard Avenue.
Awesome. Thank you so much for joining us.
Thank you.
Thanks for watching.